We started Enamory because we were working together in an academic research setting, and we were really aligned on the way that we wanted to approach our work with relationships. And I think it became pretty apparent to both of us early on that we were feeling quite stifled in a traditional academic environment. We wanted to be able to create something that looked like an academic medical center that has clinical work, that has training, that has research, but that we could really pursue the things that we're really passionate about, particularly with regard to psychedelic-assisted couple therapy.
Enamory has been my dream for a long time, and meeting Kayla allowed it to kind of like come to fruition. So I did my undergrad at UC Berkeley and started going to Burning Man, and I personally, my parents got divorced when I was about 5, so I never really saw healthy relationships. I saw a lot of conflict and avoidance and substance use, and then alcohol use. And then when I started going to Berkeley and being around kind of more open-minded people, I saw relationships that were deep and passionate and adventurous, and started to develop my own relationship with psychedelics. And then went to grad school and started following the research. It was pretty fresh at that time, but I was in Baltimore. Roland Griffiths was in Baltimore, so there were some real pioneers in psychedelic-assisted therapy. Got to San Diego and met Kayla, and we have been fortunate to work on clinical trials together. We are couples people to our core, but got the opportunity to work on psychedelic-assisted couple therapy trials. And we both had our own private practices during postdoc and started having conversations about, could we create this dream together? Could we create an academic medical center model in private where we have kind of creative freedom to do psychedelic-assisted couple therapy trials? And we kind of set out to do it. The training aspect of Enamory has come into play because we are doing this research. We're publishing in Psychology Today and peer-reviewed journals, and therapists started reaching out to us to ask for consultation. And we started doing that one-on-one and quickly realized there's absolutely no way we can do this one-on-one. And so we started developing the training. We brought on Skylar, and the only way that we're going to be able to do this is if we can train cohorts of people. And we also have the online community so that therapists can get support from us, but they can also get support from each other. So this is not a kind of siloed, we're going to keep this just in our clinic. Like, we want this to be worldwide. We want anyone who wants to be trained in psychedelic-assisted couple therapy to have access. We have different levels. We have the in-person, we're going to have virtual, we'll have self-guided. So we really want this to be accessible to anyone who wants it.
So we consider ourselves to be psychedelic-assisted couple therapists, but more broadly than that, we really believe in expansive relationships, right? Helping to build the kind of relationships that we truly want rather than feeling like we have to follow a societal script. And a big part of that is working with folks who are outside of sort of the norm of traditional relationships. We work with a lot of polyamorous and non-monogamous people. We work with a lot of people in sort of the queer and kink communities. We chose the name Enamory. It's sort of related to polyamory. Polyamory is the orientation toward multiple loves. Enamory is an orientation toward love. And it, I think, evokes a sense of expansiveness in relationships, and also keeps us grounded in what we're here to do, which is to help people love each other better.
I think that kind of orientation toward love, expansive love, can feel a little bit scary to people. I recognize that as we make more posts about different kinds of love and loving bigger and being more authentic, we'll get follows and unfollows. and it is scary to be raw and authentic and vulnerable and show up as your full self, because we're afraid that people won't love us or there won't be space for who we are. And we want to be able to create a container that anyone can come into and learn how to be authentic in their relationship, because that relationship that you can build with two or more people who are being their full selves is so much deeper and so much more fulfilling, and there is space for it, and maybe you just need support in order to do that.
Ketamine-assisted couple therapy is pretty new in the sense of being sort of in the mainstream and studied in academic research. There have been practitioners who have been working with psychedelics in couples underground for, decades, more than that. Ketamine-assisted couple therapy is really transformative in the sense that it offers couples a really unique way of getting out of places where they are stuck, and it helps therapists have a tool for helping couples get out of those stuck places. I think a pretty universal experience among people who work with couples, therapists and other professionals who work with couples, is that we can reach these moments in treatment where we can all see sort of the stuckness, we can all see the problems, and it's just such a tight knot that we get tied into. Sometimes it's difficult to know where we can loosen things up in order to get untied. And ketamine and other psychedelics are so powerful for kind of showing us new solutions to these problems that we otherwise wouldn't know were there. It gives us a lot of neurochemical benefits in terms of neuroplasticity and reward learning, and also just gives us a new psychological perspective that helps to fundamentally shift how we see ourselves, our partners, and our relationships.
People often ask us if we would choose ketamine-assisted couple therapy still if we could choose a different psychedelic. So a lot of the research with couples has been with MDMA. And our answer is always, absolutely, we would choose ketamine as an option. Most other psychedelics, your medicine session is going to be 8 to 12 hours. And that is not always accessible. And that depth of exploration is not always needed. Ketamine is amazing because it's a dissociative. It was originally used in psychotherapy for severe depression because it can break us out of these very stuck patterns very quickly. So when we're having thoughts like, I'm a burden and my family would be better off without me, we can loosen that very quickly. We have a different perspective, and people say that their symptoms drop dramatically even after the first session. And when we see couples, they're similarly coming in some stuck pattern. They have stories that are leading to rigidity in the relationship. They're closed off emotionally. And ketamine creates that openness and flexibility. And so we're able to make movement in couple therapy in a different way, in a way that has so much more ease. And we're not stuck for 20 sessions. We can do half of that and have that same movement. We created the training because therapists were asking for it. So we have been doing psychedelic-assisted couple therapy research. We've been doing clinical work in our practice. We have been training our trainees, but we had therapists starting to reach out to us after reading our articles and asking if they could do consultation with us. So we started doing that consultation one-on-one. Very quickly, that scaled to a place that we weren't able to keep up with. And we are really passionate about training all therapists and providers that want to do this work. And so we're creating the certification program so that there can be a pathway. Not only can therapists get the didactic weekend training, but they can have support as long as they want it in their careers. We have supervision opportunities, we have experiential opportunities, and we have the online community that you can stay in forever and ask questions and get consultation and continue to build with your peers.
We really want to find a path to make this kind of healing accessible to people. A big, valid criticism of the sort of modern psychedelic therapy kind of renaissance, if you want to call it that, is that it is often only accessible to people with a lot of means, a lot of financial means, a lot of time, the ability to travel, to access it where you need to access it. And the more therapists that we can train to offer this service in their communities, the more people will have access to it, right? If we train 20 therapists and each of those 20 therapists can go serve 20 couples in their practice, pretty quickly we're going to really increase the availability and access to this really important service. That's another reason why we started our nonprofit foundation, to also be able to bring in funding to support therapists to do our training who might be experiencing financial stress themselves and who serve communities who are in really dire need of these kinds of services, particularly for an affordable rate. So a big part of why we want to do this training is that in our little clinic, we can only help so many people. But if we help other therapists know how to help the people in their communities, we can do a lot of good in the world.